So that was Dr. Danial. Now, I'd like to invite our second speaker of the night, and he's very highly anticipated. I'd like to invite Assistant Professor Dr. Asfand Ali Khan. Dr. Asfand graduated from Khyber College of Dentistry in 2010 and has been a member of the Faculty of Dental Surgery of the Royal College of Surgeons of Edinburgh since 2014. He obtained his specialist degree in restorative dentistry, Masters of Clinical Dentistry, from University of Malaya, Malaysia in 2017, where he later became part of faculty as a senior lecturer and undergraduate endodontic program coordinator. He received his specialist membership in endodontics from the Royal College of Surgeons of Edinburgh in 2018 and is an examiner for the Restorative Specialty Membership Examination conducted by the Royal College of Surgeons of England. Currently, he is working as the head of Department of Operative Dentistry and Endodontics at Shifa College of Dentistry, Islamabad. Dr. Asfand, welcome. Thank you so much, sir, for joining us. The floor is yours.
The pleasure is all mine. I hope everyone is doing good. All right, so let's begin. Let me see if I can share this. Can you hear me clearly?
Yes, sir.
Good. All right, is my screen visible?
Yes, it is, sir.
Has it been shared? All right, so if everything is in order, let me see. Technical issues. Right. All right, so can everybody see my screen? Marich, can you see my screen,
Yes, sir.
please?
Yes, sir, we can.
Okay. And all right. Okay, so I was asked by Marich and the APDCA team to present on, postgraduate options in Malaysia. So as Marich mentioned, that I did my master's from there. So I'll be focusing on that. And they also asked me to tag along certain procedures that are now done in as far as endodontics is concerned. So something new, something refreshing. So it's an amalgamation of two presentations that I usually give very separately. Marij, if during my presentation, if my slides are lagging behind, if they're not changing properly, if there's any issue with my voice, please do let me know ASAP. All right? Okay, so let's begin. So Marij has given a brief introduction of myself. So let me do my own introduction a bit. So this picture is from 2009. I was in my third year. And this is my best friend who's currently a prosthodontist. He's working in Peshawar. So this is how we usually are when we are in dental school, so full of life, having the time of my life, to be honest. I don't know about you guys, but I had a blast in KCD, Khyber College of Dentistry, Peshawar. And then the final exams hit. So I refused to shave for about 3 months, I guess. So this is how I looked when I sat for my final professional examinations. Good times. And then this picture is after my house job. So towards the end of the house job, and when it ends, reality starts to hit you pretty badly. What should I do next? This is the time where panic starts setting in. Ki yaar, abhi tak to bada maza aa raha tha, life was going good. I had a blast during my 4 years of undergrad. And then 1 साल तो काम करने के पैसे भी मिले उसी जगह पे. अब आगे क्या करना है? And most of us, especially in Pakistan, have no clue. I think the current generation is much more better prepared than we were back in 2010, 2011. Frankly, I got a bit lucky in the sense कि यार बस वो things started linking up and I ended up at University of Malaya. To be honest, I gave up dentistry. Okay, I decided to move to Malaysia to open up a chicken farm, and I did manage to do that as well. But during that process, I got admission at Alhamdulillah, and I deviated back into dentistry. Was that a wise decision? I honestly don't know. But anyways, I'm lucky in the sense that I to um, got to
Sorry,
study.
sorry to interrupt you, but since most of our audience is local and is from Pakistan, we would request कि अगर आप थोड़ा सा उर्दू में बात कर लें, so it's easier for everyone to comprehend. Mix of both, actually.
I'll try, but it's automatic. So sorry. Let's take. I'll try. Okay.
Thank you, sir.
So I got very lucky. Okay. कि I got trained. जो उस वक्त अभी भी आज भी मलेशिया का best dental school है. And then I worked there for 3 years, and now I'm back in Pakistan. So the question is, सवाल अब ये उठता है कि यहाँ से कहाँ जाया जाए? ठीक है, where do we go from here? What do we do with our career? And this is the feeling that all of us, either we are going through this or we have been through this. ठीक है, कुछ नहीं पता कि क्या करना है, हाउस जॉब खत्म होने वाली है या खत्म हो गई है, 1 साल हो गया है, प्राइवेट प्रैक्टिस में जाएं, मास्टर्स करें, लाइसेंसिंग एग्जाम्स दें, किसी को उस वक्त लॉट ऑफ कंफ्यूजन, ज़्यादा कुछ समझ आ नहीं रही होती. When I got done with my house job, I started family dentistry. उस जमाने में it was unpaid, तो मैं किसी का नौकर नहीं था. I had the time of my life there as well. जब मर्जी आए चले गए, जब मर्जी आए नहीं गए. खैर, so after my family dentistry, I applied to University of Malaya, and I was fortunate enough to get in. So now the question is, out of all of these options, हमारे पास options क्या क्या होते हैं after BDS? Number 1, join a practice. Number 2, open up my own practice. Number 3, apply for licensing exams overseas. Middle East चले जाओ, US चले जाओ, UK चले जाओ, Australia चले जाओ. I think some of the speakers are here who will be talking on that as well. And then finally, पोस्ट ग्रेजुएशन कर लो. कहाँ से करनी है? पाकिस्तान से करनी है, FCPS करना है, MDS करना है या ओवरसीज करनी है? तो मैंने चूज किया ओवरसीज option back then, and now as well. I'm not a big fan of FCPS. So I chose कि यार let's try something overseas. So once I chose post-graduation and I decided to go overseas, so my motivation was, number 1, pursuit of excellence. So these 3 speakers I really admire. On your left, Dr. Yoshi Terauchi. In the middle, Dr. Mohammed Hamo. And on the right is Dr. Cliff Ruddle, who is the inventor of ProTaper. And they have reached the pinnacle of their careers. Amazing people. I've learned from all 3 of them. And how did they get where they are now? Further education. Second, post-nominal letters. So usually when I see it's nominal letter, post-nominal letters, जो आपकी degree होती है after your name. So I've seen BDS, RDS, PMDC, but by adding more qualifications, and when you put that on your board, it actually attracts patients to you. इज्जत का बायस बनता है, and that actually means a lot as well. And finally, personal satisfaction. So that was my basic motivation. I pursue something that when I reach the end of, I have complete command over it. So personal satisfaction plays a big role in motivating you to gain, postgraduate qualification. So let's look at the postgraduate qualification options in Malaysia. One is clinical, one is by research. I think research pe Dr. Qasim the, I guess, I forget the name. He talked about research. I joined towards the end of the presentation, तो कुछ ringgits में जिक्र कर रहे थे. So I think he did his postgraduate qualifications in research from USM. So basically, Malaysia has 4 major public sector universities. University of Malaya, then there's UKM, there's UITM, and there's USM. बाकी private में बहुत हैं, लेकिन basically ये 4 हैं जो आपको post graduate qualifications offer करती हैं, by clinical or by research. University of Malaya is University of Malaya, UKM, and UITM. These 3 are in Kuala Lumpur, while USM is up north on the east coast. So ये जरा 3-4 घंटे दूर है, एक गांव है, उधर है USM. It's a very good university, but it's a bit far from the center. And these are basically the programs offered by these universities. So I'll be talking about the clinical route. So University of Malaya में you get, as far as resto is concerned, तो अब उन्होंने अपना when I did it, it was Masters in Clinical Dentistry. So now they have upgraded to Doctorate in Clinical Dentistry. It's a 1+3 program. A 1+3 program का मतलब क्या है, ये लोगों को समझ नहीं आती है, so let me explain a bit. So it's a beautifully structured program. So when you join, एक साल आप पढ़ते हो, and then you sit for exam, and when you pass it, they give you a master's degree, which is called Master of Science. अगर आप यूके भी जाएं तो वहाँ भी 1 साल के बाद आपको मास्टर्स की डिग्री कुछ सब्जेक्ट्स में मिल जाती है. Then you immediately enroll into the DENTCON program. ठीक है, 2 हफ्ते की ब्रेक होती है. So in August you sit for the master's exam, and in September you enroll in the DENTCON program if you pass that master's program. Now, DENTCON program is 3 years, so it's 1+3. And the subjects they offer, as far as restorative is concerned, restorative dentistry, perio, prosto. I think endo उन्होंने अभी start कर लिया है, I'm not too sure, but they had plans to start DENTCON in endo as well. They're still offering MCLIN in child dental health, that is pediatrics, OMFS, oral medicine, and orthodontics. Plus there's Master of Community Oral Health and Doctor of Dental Public Health. ये तो हो गई University of Malaya के programs. A little bit about University of Malaya. It's the best dental school in Malaysia. By the time I left, it was amongst top 60 in the world. Now I think it's between 70 and 80. UKM also offers doctorate programs in much more specialities, which are listed here. UITM and USM offer almost the same programs. So इनमें से अगर आप किसी में भी चले जाएं, they are equally good. I had a friend who was doing his DENTCON dent from UKM. He is currently in Karachi. I went for a 1-month internship at UITM. उनकी facilities बहुत ज़बरदस्त हैं. And USM का जो master's program है clinical, it's also very good. I haven't been there, but I've always heard good reviews about it. What are the requirements? So obviously you need a BDS degree and you need 2-year clinical experience. ठीक है, 1 साल आपका house job का हो जाता है, and then 1 year you can work at an institute, you can work in private practice. So when I applied, I showed both my family dentistry का जो मेरा experience था, plus my clinical, जो मैं clinics पे करता था. So I showed them both. IELTS का उनका criteria इतना strict नहीं है, so band 6 or above. You will have an interview and a test. So interview is fairly straightforward. They check your attitude, but it's basically all about your passion. Basic question होते हैं कि what have you been doing for the 2 years? Continued dental education में आपने क्या क्या किया? How did you improve yourself, etc., etc. Why this program? All the basic questions that हर interview में तकरीबन same ही होते हैं. Plus they will send you an article जिसका आपने critical appraisal करना है. So those who don't know what critical appraisal is basically reading that article and then deciding if it's a good article or not. तो क्या उसकी methodology valid है, जो उसके objectives हैं, क्या उसका conclusion उससे match करता है. So on how to critically appraise an article, there's method behind it, and that is, you can just Google it and you will get the technique how to critically appraise an article. It's not that difficult. And then finally, you have to go there and give a test cavity. Now, you have to make a class 2 cavity or an access cavity or crown preparation on a mannequin at UM. When I applied, the point number 3 was exempt for expats or overseas students. But similarly, बाकी 3 universities का भी कुछ ऐसा ही है. So the major chunk of the marks जहाँ से decision होता है, that is from your interview. Now, how can you cut above the rest? So it's a very highly competitive program. Unlike here, unlike in Pakistan, they take candidates every alternative year. So they're not taking any this year, but I asked University of Malaya is opening up admissions January next year. So go to their website and it should be there somewhere around January. They will announce admissions. I think unka Prosto program is amazing. A restorative is also very good. So how can you cut above the rest? Because it's a very competitive program, and for foreign students, there's usually basically total seats ही 5 होती हैं या 6 होती हैं, जिसमें से foreigner वो 1 या 2 ही लेते हैं, इससे ज़्यादा वो नहीं लेते. So it always helps to have MFDS, MJDF or MFD from the Royal College. Publications, people ask how many publications. If you're good at research and you just have one publication in a good journal, that is more than enough. So the journal matters, Web of Science हो, international हो, indexed हो. अगर आप उसमें publish कर जाएं, तो you're golden. Just one publication. For me, I didn't have any international publication. I had 5 local ones. Membership in associations of interest. So this shows your passion for dentistry. So let's say in Pakistan, there is Pakistan Association of Operative Dentists and Endodontists. You can join that. Pakistan Orthodontic Association hai, PPA hai, Pakistan Prosthodontist Association hai. So you can join that, and you can be an active member of that by arranging conferences, by working hard in these associations. And you can show that in your CV, and that actually really helps. And continue dental education in the field of interest. So you can show that you went to conferences, you did courses. अगर आपके पास 6 महीने के diploma है, C&O courses. So all of these show your passion, your attitude, you want to pursue excellence in dentistry, and that will help you get in these universities. I think these basically publication, memberships in association of interest, and CDE in field of interest. These are applicable for any postgraduate program you apply overseas, be it Malaysia, Australia, Hong Kong, Singapore, UK, etc. All right, so you got in. Okay, आपको मुबारक हो, आपको admission मिल गया है. Out of, let's say, 10-20 candidates, you're the one who got the admission. Now what? Well, welcome to hell. At University of Malaya, it was a very, very hardcore, difficult program. It's 4 years. There were many sleepless nights. They will actually really grind you. Matlab ke really, really grind you. It's actually very tough. So if you have a family, भूल जाएं, दोस्त यार भूल जाएं, 4 साल रगड़ा खाने के लिए आप तैयार हो जाएं. ठीक है, ठीक ठाक आपको रगड़ा मिलता है, but in the end, they make something out of you. So उस वक्त तो बहुत बुरा लग रहा होता है, लेकिन by the time you get done with it, you actually feel pretty confident in your skills. So जितने भी ये universities हैं, the clinical programs है, they basically divided into 3 components. So there's clinical training, which is 60%, counts for 60% weightage. Then academic teaching, 25%. And then research is 15%. Because the clinical program, you have to submit a thesis of about, let's say, 20,000 words. You will be given funds to conduct that thesis, but you have to finish it on time. क्योंकि 4 साल में आपने सब कुछ खत्म करना है. So therefore, because the clinical program, research की weightage थोड़ी कम है. So first year तकरीबन सब में यही होगा. Basic medical science होगा, research methodology, preclinical, mannequins पे आप fillings या because I am from restorative. So crowns, fillings, endo, general dentistry का जितना भी है 1 साल आप ये करते हो. Year 2 and 3, there's clinical teaching, so you will be doing your own patients. There's seminars, journal clubs, written examinations, clinical examination, and thesis defense. And year 4 is basically the same, but इसमें ये आपको attachment पे भेजते हैं. So for me, when I was doing it, they sent me to UITM for a month. But now उन्होंने अपनी फीस बढ़ा दी है University of Malaya वालों ने. And I think last time they sent the batch to UK, Queensmary, महीने के लिए for attachment. And then after that, the next batch they sent to Otago University, New Zealand. So you get some overseas exposure as well. And सबसे अच्छी बात है कि by any of these, if you sit for any of these, if you get in any of these universities, their training programs are recognized by the Royal College of Surgeons in the UK. So just a brief summary कि जो 3 Royal Colleges in UK के Irish की बात नहीं कर रहा. So there's Glasgow, there is England, and there is Edinburgh. And then there's one Royal College in Australia as well. So as shown on this slide, after you finish your master's, आपने 4 साल your master's या doctorate आपने 4 साल गुजार लिए, ठीक हो गया. So I started in, let's say, September 2013, and my exam was in somewhere around क्या कहते हैं, August 2017. So उसी महीने Royal College की team will visit that faculty, and you get to sit for the Royal College Specialist Qualification by one of the Royal Colleges जिनकी agreement हुई हुई है with your university. So let's say I was with University of Malaya, so they have an MOU signed with the Royal College of Surgeons of England. So when you're done with your declined dent, you get automatic eligibility to sit for this exam. And once you pass this, you don't have to go anywhere. They will come to you. So once you pass this, so at the end of 4 years, basically you have 3 degrees. You have a master's, you have a doctorate, and you have a membership qualification or a fellowship from one of the Royal Colleges. I think that's a pretty sweet deal. कि 4 साल बाद आपके पास 3 डिग्रियां, and you will be a specialist in Pakistan, you will be specialist in Malaysia, and you will be a specialist in the UK or Australia as well. So it's a pretty sweet deal. So that's about it. There are some of the images when I was doing my master's. It was a very tough time. These are my batch fellows. This person here on the upper right side is Dr. Ishamsul Suleiman. He's the head of the PROSPER program. He came to Pakistan, I think, early this year. He is an amazing friend. He's my teacher as well. And I miss it. To be honest, it was a very tough time, and I really do miss my time at University of Malaya. I had the time of my life. So now what? Postgraduate हो गई, उसके बाद भाई उसके बाद भी यही है, ठीक है. So life after post graduation. So if वो डॉक्टर फैजान की बड़ी अच्छी वीडियो है कि FSC कर लो, उसके बाद मजे ही मजे, डॉक्टर बन जाओ, उसके बाद मजे ही मजे. लेकिन जिस तरह इमरान खान कहता है कि सुकून सिर्फ कब्र में. So anyways, jokes aside, life after post graduation, so you will get good opportunities. They might hire you. You will be already a specialist in the UK. So if you qualify the ORE examination, let's say, तो आप वहाँ पे automatically specialist बन जाते हो. So that's about it for the first part. I'll try to be a bit more. We started, I think, 10 minutes late. So 20 minutes में ये हो गया, and further 20 minutes for the next part. So those of you who have not been to Malaysia, I would suggest that everybody who goes to Malaysia, they talk about either Kuala Lumpur or Langkawi, but nobody talks about the East Coast Islands. East Coast Islands are amazing. So these pictures are from Redang. You can do scuba diving here. I love it. There's Turtle Bay. You can swim with really large turtles. Pristine, clear blue waters. It's heaven. much better than the water quality in Langkawi. I think Langkawi is just too commercialized now. Okay, so Marich, all good? Can we start with the next part of the presentation?
Yes, sir, we can. We
Everything?
already have a list of questions regarding the first part of the lecture. So do you want to address those first, or do you want to do those in the end altogether?
All right, 5 minutes, then we can move. 5 minutes for question answer. So I'll be as quick as possible and then we can begin for the next part.
Okay, so sir, first main jo hai question that's regarding the basic degrees between you said jo MCLIN Dente. What's the fees for it? Are there scholarships available, fully funded scholarships? And after MCLIN Dent, if you're trying to practice in the UK, do you have to give the OI exam, or can you straight away go over there and practice, since you said that it's recognized over there as well in the UK?
All right. So all over the world, clinical programs with scholarship are very rare, if not non-existent. Okay. But as my friends in Malaysia say that, but they use a specific word, Maba Bank. Maba Bank was actually Mama Baba Bank. So your parents will have to fund that. It's very simple. After BDS, there's no way us as recent graduates can afford it. But having said that, think of it as an investment. I think people need to realign their thought processes around it. आप इसको ऐसे सोचें कि अगर लेट्स से आप कोई बिजनेस स्टार्ट करते हैं, एनी बिजनेस, यू इन्वेस्ट आपने अपना क्लिनिक खोला, आपने इन्वेस्ट किया है उसमें, and then you expect a certain return. So in my particular example, let's say my fees in total for 4 years at that time was in Pakistani rupees around 50-60 lakh रुपए के करीब total. I think much cheaper than BDS that is currently going on right now. So, but the day I finished my master's, I got offered a job at UM, and UM gave me back all that money within 1 year, जो मैंने 4 साल में लगाया. And now that investment जो आपने अपने ऊपर की है in 4 साल, it gives lifelong returns. So you earn on it for the next 20-30 years. So basically there are no, पहली बात तो ये scholarships तो नहीं, unless the government sponsors it. So जो मेरे साथ local colleagues थे, जो Malaysian थे, उनकी government या वो किसी यूनिवर्सिटी से आए हुए थे, they were employed by, let's say, USM, and USM sent their student to UM to get their masters, and it was paid by US, or the government pays, and then they sign a bond for 5 years with that government. Pakistan, unfortunately, does not offer that for clinical programs, so scholarships are almost non-existent as far as Malaysia is concerned. Secondly, regarding UK and Australia, so you will be a specialist, but you still do have to qualify for the licensing exam. तो आपको ORE फिर भी देना है. That's a must.
सही हो गया. And our second question was, how do we get a license to practice as a dentist in Malaysia?
There's only one way as an expat that you can get that, and that is called the spouse program. You will have to marry in Malaysia. You have to marry a Malaysian. There is no two ways about it. I was working there for 3 years. So how did I manage to do it? So as a expatriate, basically most of Pakistani Indians, foreigners, they would work in Malaysia in an academic institute, and for that you have to be a specialist. So उसमें आप कर सकते हो academia. In private practice आप नहीं कर सकते, आपको license वो नहीं देते. Basically, there are 2 types of license in Malaysia. One is an annual practicing certificate, which is your permanent license, and one is your temporary practicing certificate, जो आपको academia होते हुए government आपको देती है. So you can work in the premises of the university. You can do your patients, you can teach, but you cannot go to private clinics and work. Unless you marry a local, and then you have a pathway. फिर आप exam दें और आप बेशक वहाँ पे settle down.
That's a very unique path. So
It is. So my colleagues, my friends, they were like, Asfand, some of them were not Muslims. They're like, Asfand, you're Muslim, दूसरी शादी कर ले. मैंने कहा भाई नहीं, एक.
That's nice, sir. And sir, बहुत से concern है between 3 different degrees. जैसे आपने कहा Masters of Clinical Dentistry, then there's Master of Dental Surgery, MDS, then there's MCPS. बहुत से बच्चों को इसमें confusion है. What's the difference between these 3?
So if you, let's say it's all in the name. So let's say you go to National University of Singapore, ठीक है, वो आपको MDS की डिग्री देते हैं क्योंकि उस कंट्री में स्पेशलिस्ट क्वालिफिकेशन को MDS कहा जाता है. So let me summarize a bit. I can be a bit confusing, but basically there's 2 pathways to become a specialist. One is a TOT program, that is you enroll in a university and you pay that university. उसमें आपको MDS मिलता है, M-Clin Dent मिलता है, D-Clin Dent मिलता है. So यूनिवर्सिटी ऑफ ओटागो न्यूजीलैंड आप जाते हो, आप उनको पैसे देते हो, 4 साल या 3 साल पढ़ते हो, वो आपको डॉक्टरेट ऑफ क्लिनिकल डेंटिस्ट्री दे देते हैं. You become a specialist in New Zealand and you can register that degree anywhere. आप मलेशिया जाते हो, उसको M-Clin Dent कहा जाता है. आप सिंगापुर जाते हो, उसको MDS कहा जाता है. सेकेंड ऑप्शन इज बाय ट्रेनिंग. सो जिस तरह पाकिस्तान में FCPS है, ठीक है, here there you get paid. ठीक है, in FCPS you do get paid. It's training, it's not a degree, it's actually a diploma. And at the end of the 4 years, you sit for the exam, you pass it, you get that qualification, you get those post-nominal letters at the end of your name. But you get paid during the process. Those opportunities, I think they work in UK में कुछ pathways हैं. I'm not very too sure about it, but they're mostly for locals. और foreigners के लिए basically आपके पास सिर्फ ये TOT programs ही होते हैं. If you want to go overseas. In Pakistan, you have 2 options. You have FCPS. MCPS 2 साल का होता है as compared to FCPS. MCPS is now completely almost out of fashion क्योंकि FCPS अब इतने ज़्यादा हो गए कि MCPS कर भी लेता है तो जॉब्स वगैरह नहीं मिलती हैं क्योंकि FCPS काफ़ी ज़्यादा. And then you have MDS, which is a degree given by the university. I think some in PIMS you get paid for MDS, but in other private universities, Gandhara ho gaya, University of Lahore ho gayi, I think you have to pay to get that degree.
Okay, so thank you so much, sir. That's all of the questions covered for this portion. Now you can move on to your next part of the presentation.
All right, so now what's the latest in endo? So I'm going to be talking about microscopes, ultrasonics, and CBCT, and how they have revolutionized the concept of endodontics. I'll go through this very quickly. We don't have much time. We have further question and answers as well. So when I was doing my house job, I hated endo. मुझे बहुत ज़्यादा बुरी लगती थी. क्यों? क्योंकि नज़र ही कुछ नहीं आ रहा. पेशेंट बैठा हुआ है, आप उसके दांत में एक पतली दांत का साइज देखें, फिर किनाल का साइज देखें, फिर पतली सी फाइल देखें, फिर पेशेंट बैठा हुआ है, ही इज इन पेन, आपने एनेस्थीसिया दिया, कभी इफेक्टिव होता है, कभी नहीं होता है. ठीक है, आई थिंक यू गाइस शुड बी गोइंग थ्रू द सेम एज वेल. एंड देन द पेशेंट तकलीफ में भी है, ही स्पिटिंग, उसने स्पिट भी करना है, सलाइवा भी दांत में जा रहा है. इट्स अ मेस. नजर भी कुछ नहीं आ रहा. फाइलिंग करते वक्त आप डे ड्रीम कर रहे हो, ऊपर छत को देख रहे हो. So I hated endo. Then I got a chance to assist someone who used a microscope overseas, and basically I fell in love with it. For the first time, I actually saw how actual endo works. File kaise canal mein jati hai, how does it cut, how does irrigation works, because now I can see it. So this is Dr. John Stropko. He is a very famous endodontist, and he says if we can't see it, we can't do it. So according to him, if I can't see what I'm doing, there's no point in doing it. So for him, endo should only be done under a microscope. But I disagree. We have got excellent results from endo without a microscope. So maybe we can modify it. And if we can modify this code by, let's say, if we can see better, we can do better. तो जब आपको बेहतर नजर आ रहा होता है तो चीज आसान भी हो जाती है, and results outcome भी बेहतर हो जाता है. So then this brings us to the trifecta of success. So microscope, which allows us real-time visualization of what we're doing. Then we have the CBCT, जो कि आपको सारे हिडन वंडर्स इनसाइड द टूथ आपको दांत खोलने से पहले ही बता देता है कि भाई मसला क्या क्या है. And then we have ultrasonics, which allows us precision. कि भाई we cut exactly where we're supposed to cut. This preserves tooth structure and improves long-term outcome as well. So we will be discussing all three, and then I'll be showing cases where all these three work together to give excellent outcome. So why use a microscope? I will give you three reasons so you can treat better what you can see. So on your left is visualization from the naked eye, then 3.5x loops that you use. But with a microscope, it goes as high as 25x. So when you can see better, obviously, you can take care of that problem better. You will be more precise, more accurate, and very conservative. And to be honest, in the long term, patient are really happy with it. कि भाई आपने उनका extra दांत नहीं काटा, you were very precise, accurate, pain relief भी हो गया, कोई चीज miss भी नहीं हुई, and obviously that helps in the outcome. Ergonomics. So on your left, this is how we are by the end of the day. A bad back is the bane of every dentist. But with a microscope, you get to sit in a very comfortable position throughout the day with good back support, and your spine is in neutral position. The patient is comfortable, and most importantly, you are comfortable. And by the end of the day, you are actually more fresh as compared to when you don't use a microscope. And finally, visualization and documentation. So what you see with the help of a microscope, you can record it. You can share that with your colleagues. You can share that with the patient. And you can actually display it as well in real time. So when I was doing my undergrad, अगर कोई endo का demo दे रहा होता था, तो मैं अकेला लगा हुआ होता था. Sorry, the demos जो हमारा demo था, he would be showing us how to do an access cavity, how to do canal prep, and 10-12 का एक जमगट्ठा उसके गिर्द बैठा होता था और किसी को कुछ नजर नहीं आ रहा. But with the help of a microscope, so now when you do, let's say you're doing any endo case, your students can actually see it live, and it actually accounts for much better learning for them. So किस किस में microscope इस्तेमाल होता है? Diagnosis, open apex management, MB2 जो कि मिलती ही नहीं है, but with a microscope, it actually is very easy to find it. Any perforation, retrieval of separated instrument, and episectomy. So I'll be discussing some of these cases with you as we go along. Ultrasonics. So with the advent of microscope, dentists को थोड़ा एक मसला आना शुरू हुआ, because now we can see better inside the tooth. जो hand piece है, it's actually quite big. ठीक है? And it started obscuring the view of the dentist while they were working under the microscope. So they came up with ultrasonics. Ultrasonic technology was already in use since the 1970s for scaling. So they made special ultrasonic generators which generate more power, and they made special tips which actually cut tooth. So ultrasonic tips are quite narrow, and under a microscope, it provides better view of the operating field and greater cutting precision. So for different applications, different tips are available in the market. So the one on your left with the yellow band is actually for broken instrument retrieval. Then the one to its right here is actually for episectomies. This number 3, the tip number 3 is for finding MB2. And the one on your right is for activation of intracanal irrigants. Application kya kiya ultrasonics ki? So we can use it in the access cavity to refine it, locating calcified canals, middle mesial canals, MB2, with pulp stone pada hai, wo hat jata hai, so endo becomes much more easier. Doing root canal treatment, GP removal, post removal, separated instrument removal, apical surgery mein inka kafi role hai. And then activation of irrigating solutions. It actually helps remove debris from the canal. Calcium hydroxide activation agar aap karte hain, so it actually helps pushing that calcium hydroxide deep inside the canal and into the dentinal tubules, which results in greater disinfection. And then finally, CBCT. So let's have a look at this case. So this patient came, she had pain on biting. And if we have a look here, we can see that in the mesial root, there's a fractured instrument. So this patient actually went to get a crown in the UK, and they said, look, there's a fractured file in your tooth and you need to get it removed. So this, when she came to Pakistan, she came to me and she's like, Dr. Asfand, there's a file and I've heard that you remove fractured files. I was like, yes, so let me have a look. So if I just followed this radiograph, what I would do is remove the filling, remove the GP, and then reach the file in the apical third and then try to remove. But now I've made it a habit in complicated re-endo cases, I always take a CBCT. So CBCT actually eliminates all surprises for me. Before even I open a tooth, all the surprises are gone. So a CBCT was taken, and what do you see? So we have a fractured instrument. And Dr. Marij, is the pointer visible?
Yes, sir, it is. The red dot, it's visible in the apex of the root.
So we have a fractured instrument here, but the previous dentist not only fractured a file, but in trying to bypass it, perforated the root as well. And we can see some sealer or GP here in the periapical tissue, leading to a large periapical lesion. So now this case becomes more complicated. If I, let's say, follow my previous plan of orthograde retreatment, कि मैं दोबारा canal खोलूं, दोबारा दांत खोलूं, canal में जाऊं, GP remove करूं, and then file remove करूं, it would be very difficult क्योंकि already perforation हो चुकी है, and my instruments will go straight in the perforation and worsen it. So CBCT actually helps me in deciding my treatment plan. In this particular case, we decided to go for a surgical option. So a flap was raised, a osteotomy was done. So as you can see here, this is the mesiobuccal root, and we can see the GP here, perforation site nazar aa rahi hai. The root 3 millimeter of the root tip was cut. So this is the mesiolingual canal of the mesial root, and this is the mesiobuccal canal, and here is your file. And then MTA was placed. Okay, so this is the mesiobuccal root canal, this is the mesiolingual canal, and then MTA was placed, and this is post MTA placement. Now, 6 months down the line, the patient is pain-free. She's going to come back to Pakistan in June, so I will then update, have another radiograph, and see how that goes. Here's another case. Okay, so this case was referred to me by my specialist, my teacher, endodontist at UM. So this is a 60-year-old female patient, and she couldn't find any canal in the mesiobuccal root of the upper six. She was working with a microscope, no canal was visible. So CBCT was taken. As you can see in the sagittal view, we can see a very thin outline, but basically it's not a canal. And on the coronal view, we can see some remnants of a canal, but they're very, very thin. So we decided to go for a surgical option in this one as well, apicectomy karni hai. So this helps us plan. CBCT helps us plan. We can measure from your crown all the way to the root apex. So CBCT measurements are very accurate. I would know, or somebody who's doing the surgery would know exactly where to drill because the buccal cortical plate is intact. Plus, in this particular case, the high risk was, let's say, मैं 2 to 3 millimeter भी off होता हूँ अपने निशाने से, so I'm in the maxillary sinus. So again, CBCT helps in diagnosis, and in deciding your treatment plan, and in planning as well. कि यार अब ये तो हमने करना है, surgical option करना है, how do I go about doing it? If you look at these pictures, okay, so one on your left, the one with the pointer here, is actually the periapical radiograph with the fractured instrument. Does not have any periapical lesion. Patient wants a crown. आप इसको देखोगे, endo was done a year back. You will see this tooth. Okay, file तो टूटी हुई है, लेकिन इंजेक्शन कोई infection नहीं आ रहा. RCT हुए साल 2 हो गया है. ठीक है, bone भी ठीक लग रही है, let's go for a crown. But when a CBCT was taken, look at it over here, so there's a periapical lesion. So now your treatment plan changes from crown. Now you have to retreat this case or extract, either of the two. So CBCTs, they show significantly more lesions than periapical radiography, and CBCT actually directly influences endodontic retreatment strategies. All right, so even you're a general dentist, you're a specialist, does not matter, but CBCT will actually influence your treatment plan one way or the other. I am very pro CBCT for endodontic procedures. Okay. I see dentists doing endo based on OPG, और OPG का ये फंक्शन बिल्कुल भी नहीं है कि वो उस पे आप endodontic treatment plan करें, but it happens all the time in Pakistan. तो क्या OPG for endodontic, everyone is fine is that, ठीक है, acceptable है भाई, सब कर। लेकिन जब मैं किसी को कहता हूँ कि यार CBCT करवा लो, especially my colleagues in dentistry, they look at me as if कि यार I am mad or something, कि यार CBCT भाई। तो तीन रीजंस हमें, दो रीजंस बेसिकली मुझे दिए जाते हैं यार CBCT क्यों मैं नहीं भेज सकता अपने पेशेंट को CBCT के लिए। नंबर वन, इट्स कॉस्ट। टू बी ऑनेस्ट, फ्रैंकली स्पीकिंग, अगर आप उस पेशेंट का दांत बचा सकते हो, एंड आई थिंक CBCT कॉस्ट अराउंड 5,000 rupees. And if the patient can afford it, I understand affordability is an issue, but it's 3,000 का भी हो जाता है. OPG is roughly around 1,800 to 2,000 rupees. So CBCT 3,000 to 4,000, I think in an institute, it's not that expensive. And number two, जो explanation दी जाती है वो है भाई कि radiation बहुत ज़्यादा. So if you take a low FOV CBCT that is specifically for endo with higher resolution, उसमें आपके पूरे मुंह का CBCT नहीं होता. द रेडिएशन इज एक्चुअली फोकस्ड ऑन 3 to 4 टीथ जो आप साइट आइडेंटिफाई करते हो, एंड द रेडिएशन डोजेज इज इक्वल टू एन OPG. बिकॉज जो लेटेस्ट CBCTs हैं उनकी रेडिएशन डोजेज इज इक्वल टू एन OPG. तो अगर आपको OPG कराने में मसला नहीं है तो आपको CBCT भी कराने में मसला नहीं होना चाहिए. तो फॉर ऑलमोस्ट एवरी रीट्रीट केस नाउ आई गो फॉर अ CBCT. Surprises नहीं चाहिए. Actually CBCT has been shown to reduce stress levels in dentists, क्योंकि आपके पास सब कुछ पहले नजर आ जाता है भाई, किनाल्स कितनी है, किस किनाल में क्या मसला है, लेच तो नहीं है, फ्रैक्चर्ड इंस्ट्रूमेंट तो नहीं है, परफोरेशन तो नहीं है, वो सब कहानी आपको पहले पता होती है. सो यू गो इन विद अ प्लान एंड इट मेक्स योर लाइफ वेरी स्ट्रेस फ्री. Dentistry, to be honest, is a very stressful profession. You're working in very small space near to very vital organs. The patient is usually unhappy, क्योंकि आप किसी को आधा घंटा 40 मिनट मुंह खोलने का कहो तो वैसे ही तंग होता है इंसान. So CBCT actually does help you in avoiding pitfalls and overall improving the outcome. Let's look at a few cases. So cracked tooth diagnosis. So here a microscope comes into play, क्योंकि cracked tooth radiograph even CBCT पे खास नजर नहीं आता. So in this case, the patient complained of pain on biting. So we decided to go in. Let's see what happens. So थोड़ा सा drill किया, we can see a crack line going around in the mesiodistal direction. Then we drilled some more. We can still see that crack line. And then we can see that crack line going down the canal orifice. So when the crack line goes down the canal orifice, this means the tooth is not savable. So this tooth was then extracted. Now let's say you don't have good magnification, क्योंकि X-ray पे तो आपको crack line नजर नहीं आती. Patient complains of biting. He comes to you and you say कि यार ठीक है, endo कर लेते. You do the endo and the patient pays with his time, patient pays with money, and at the end of the day patient की concern हल ही नहीं होती. So what does that do? उस patient के सामने आपकी repo tanks and you are stressed as well कि यार मैंने इतनी अच्छी endo की है, patient का मसला क्यों नहीं हल हो. All of us, we want our patient to go happy from us कि भाई यार अच्छा काम हुआ है, now I am pain free, my tooth is okay. But if your diagnosis is wrong, your solution will also be wrong. So microscope actually does help in diagnosis. So in this particular case, instead of treating this tooth and putting the patient to long-term misery, we decided to extract and replace it with an implant. The patient was happy. All right. So open apices. So let's have a look at this video. I hope it's clear. Okay. So open apex management is a bit tricky because obturation is difficult, but with microscope, it becomes fairly easy. So this particular tooth, trauma ki history thi many years back. So the tooth was open, root canal was irrigated, dried, and you can see actually the periapical granuloma through that tooth. And when you can see better, you can treat better. So with a microscope, you can see exactly where to place that MTA plug so that it doesn't cross. आगे नहीं चला जाए. It stays in that place. There is no over obturation. So you slowly start putting in MTA and then you gently compact it with paper points so that you get a nice 4 to 5 millimeter plug that does not cross the boundaries of your tooth. So we have a plug now, and there you go. So it's right where I want it to be. So next visit, when the patient comes back, the MTA is hard. We dry the tooth up. Okay, we check if the MTA is set or not. It is set. And then the rest of the canal is filled up with thermoplasticized gutta percha. All right, there you go. Finding the elusive MB2, microscope helps here as well. If you don't have magnification, you have 17% chance of finding the MB2. With loops, that jumps to 62%. With the microscope, 71%. So if you don't have a microscope, that's fine. I think my recommendation is always invest in good loops with a good light. So when you see better, you treat better. So in this particular case, what we see here is this is the MB1, and we can see this dark spot here. So this dark spot was chased with ultrasonics, and then we managed to put in a size 8 file, and here is your MB2. So not finding MB2 is a big reason why nobody likes doing endo in maxillary molars, because a missed MB2 is #1 reason for root canal failures in maxillary molars. Retreatment cases may be ultrasonics and microscope really does help. So in this particular tooth, this was done by one of my colleagues. She is an endodontist as well. So root canal treatment was done, but the patient still complained of pain from the tooth. And there is 2 canals. And what you see here is a fiber post in the parietal canal, which is bonded to the tooth. So the fiber post is of tooth color, it's transparent or whitish, it's difficult to see. So here, magnification and ultrasonics come into play. So let's have a look. So there we can see the post after removing the temporary filling. And then using the ultrasonics, the post was slowly drilled out. So that is the post. And we slowly grind it out. We make sure that we do not cut any unnecessary tooth structure. And finally, we can see the GP in both the canals. And then the GP was removed using retreatment files. So here is your pre-op on your left, then trial GP radiograph, and then after obturation and after another post placement. So you compare the image on your left to the image on your right, pre-op and post-op. You can then we all right. So 1 second, please. Thank you. So with the advent of microscopes, like I said, instruments became smaller. So in surgical endodontics as well, we have smaller mirrors, we have ultrasonics to remove cut bone as well. Even the microblade is available now. And this is what I'm talking about. So with a handpiece, you can't see where you exactly you're cutting, but with an ultrasonic tip, you can see exactly where you're drilling. So let's look at a case. So in this particular case, there was chronic apical abscess. The canal refused to dry out. And this was done actually by one of my postgraduate, Dr. Rana at University of Malaya. And I was supervising this case, but she was the main operator. So let's have a look. So this is the preoperative radiograph. CBCT was taken. The size of the periapical lesion looks quite big. Obturation was done. Flap was raised. And then using ultrasonics, we did the osteotomy, and this is the cyst that was removed. So during episectomies, we removed 3 millimeter of the root tip. So now because we can see better, we can be exactly sure where to cut. So the area was marked and it was checked again that it's exactly 3 millimeters. And then using this ultrasonic saw, we cut the tooth apex. So here is after the episectomy, we can see the canal. The obturation material was removed using a ultrasonic dip. So you can see the canal here, nice and clean. This is after removing the obturation material from the apical region. MTA was placed. And here is the post-operative. This is 3 months review and healing is going just fine. So pre-operative, post-episectomy, and then finally 1-year review. And we can see that tooth is still in place and healing is just going fantastic. And then finally, I think we're coming towards the end, so I'll wrap it up quickly in about a few minutes. Fractured instrument, हर कोई file तोड़ता है. All of us are afraid of file fracture. जब हम rotary इस्तेमाल करते हैं तो actually fracture rates go up. And there are many ways to go about removing a fractured file. There's braiding technique. We have Stieglitz forceps, Mazarin kit, but the most predictable is using ultrasonics. So let's have a look at how we can use microscope and ultrasonic to remove a fractured instrument. The Mary Kay technique is a modified form of. So there was 2 fractured instrument in one canal in this premolar. This case was referred, a size 15K file. So under the microscope, we can see that file. It's right there. And Gates-Glidden was used to create access to it. And then using ultrasonics, dentine was cut with precision all around that file. So now with the probe, we can see that the file is moving, but it's still stuck because it's a very long file. So 3 millimeter तक तो आपने उसको free कर दिया dentine से, but जो नीचे 3-4 millimeter, that is still engaged with the dentine. So now we need something to grab it and take it out. So in Mary-Kay technique, which is named after my supervisor, Dr. Mariam, who taught me this, and K is Khan, that's me. So we take a 25 gauge needle, remove the bevel, use a H file to remove any flash so that the lumen is nice and clear. So we bend the needle so we can see it under the microscope. And here's the magic ingredient, Elfie. So you scoop up the Elfie in that needle tip very quickly. Everything should be ready. And you wipe out the outside so that ye na ho ke ye bhi atak jaye daant mein. And then immediately you take this in the patient's mouth, and under a microscope you can see it, and you can put this tip, this needle tip, around that fractured instrument. 7 minute आपने इंतजार करना है, बहुत सारी दुआएं पढ़नी है, and then try to remove it with a counterclockwise rotation. There you go. So coming towards the end, where's the future at? Now we have microscopes with ultraviolet filter, which actually tells you where the caries or composite restoration is. And this actually helps in removing just that part that you want to remove, rather than, किसी को नजर ही नहीं आ रहा composite किधर है, दांत किधर है. So removing it becomes, let's say in retreatment cases, या आपने filling replace करनी है, it actually helps. So caries section as well now comes built in with microscopes. And this is Navident. So it's basically what it does is कि ये machine CBCT के साथ you put the CBCT software and you link it up with this machine, and you put probes on your handpiece as well as on the patient mouth. So this machine, what it does is, let's say you're doing an episectomy or you're opening up a calcified canal and you don't know where to drill. This machine in real time will tell you the position of your burr or your ultrasonic tip with respect to the tooth in real time. Right move करें अपना burr, so on the screen you will see it moving away from the tooth. If you move it to left, let's say, and then you can see it moving towards the tooth. So that's about it. Thank you very much. I'm sorry I'm a bit over time, but my topic was, I guess, too vast. I tried reducing it, but sincere apologies. All right, any questions?
Thank you so much, sir, for this amazing and innovative lecture. I'm sure this lecture will be a guide and a blueprint for all our students who want to pursue for their future career goals. And we may सारे questions for you, and most of them are like very good responses. They are amazed by the file technique जो आपकी है, and they're amazed and they want a separate lecture on that specific technique itself. So that's
some other day then, inshallah, hopefully.
Inshallah, sir. And we have a few clinical questions regarding this topic, the second half.
Sure.
Many of them are interested in loops. You mentioned the importance of loops in clinical
Okay.
practice. So a student asked, how can you ask, hey, can you ask sir, what loops would he suggest as a newly graduate?
Okay, so usually I've asked my students at Shafa as well to buy loops. So my success rate, I think, is 2%. I think 100 students में से 2 ने अभी तक ली है. So I'm still working on it. But I have a pair of loops as well that I use for resto work. I got it way back in 2014 and they're still working fine 10 years later. So it's an investment. Think of it again. वही mindset लेके चलना है कि एक दफा लें, अच्छी चीज लें और उसको लंबे अरसे तक इस्तेमाल करें. So in the long term, it gives more value for money. So in Pakistan, you have basically very few limited options unless you want to go buy from overseas. So one of my students, she's now in house job. In final year, she managed to get from Lumadent in the US with the lights. So it cost her around $1,500. Lekin here's the thing. उसने 5x लिए हैं. They are prismatic, so she can sit straight like she's working on a microscope. उसकी back भी ठीक है. Prismatic loops actually work by having 2 lenses. So it goes straight and then it goes down. Pakistan, you have option of basically 3 options. So you have Zoomax, which is quite good, fairly cheap. I think 70,000-80,000 में आपको pair of loops मिल जाते हैं, 3.5x. So basic minimum is 3.5x. उससे नीचे लेना जाती है क्योंकि you get very used to it and then you're like काश मैं ज़्यादा magnification के लिए लेता. I got my first pair of 3x and I still regret it to this day. I wish I had gotten 5x at that time. So 4 to 5x ke darmiyan, you get your first pair of loops. Get light as well if you can. Light is almost as expensive as the loops. So you have Zoomax ka option. 18th makes fairly decent loops as well. And if you want to go something better, then Univet is a good company. I think there's a distributor in Lahore. But be careful. I think from the stories, what I've heard is that there is आपको दे देता है लेकिन 4-5-6 महीने के वेट के बाद. But Univet loops are quite good. So take around 4 to 5x loops. Initially, I bought those cheap Chinese loops of eBay. eBay पे मिलती थी तकरीबन 15,000 रुपए की 10,000 रुपए की उस जमाने में. I think now they cost around 20,000 rupees. I would not recommend them. Your eyes are very valuable. अपनी नजर आपने खराब नहीं करनी. Plus with magnification, you want good clarity. If you don't have good clarity, आपके सर में दर्द होगा, आपकी नाक पे दर्द होगा, and you'll be like यार ये क्या है? And there's a learning curve to loops. तो अगर आपको ये लगता है कि आप पहनेंगे और पहले दिन ही आप काम शुरू कर देंगे, it's all gonna be fit. ऐसा नहीं होगा. You have got to work at it. आपको कम से कम 1 महीना लगेगा. So you start with scaling. I would do my scaling with loops. It's easiest, the most easiest procedure there is. And then once I got used to them, I moved on to filling and then root canals. So don't go for cheap loops. At least go for, Zoomax. They will be Chinese, Zoomax and 18th, but good quality. So because Zoomax is, I think, fairly decent. Marich, can you hear me? I think. Is my internet working fine? Can anyone else hear me?
Yes, sir, your internet is working perfectly fine.
Yes, sir, we can. We have one more question.
Marij, your internet is disrupting.
I'm sorry, my internet was unstable. We have one more question left, and that was regarding the surgical microscopes and the CBCD that you mentioned. More of the people are asking it's not cost effective, or some of their institutes don't have them. So what's the solution? How do they manage the same practice or the standard of practice without these things? or how do they cope up with it?
So to use a microscope, you need specialist training. So unless and until you're not a specialist, microscope is not applicable for you. So those who are asking कि यार हमें ये instrument retrieval technique सीखनी है, it's very simple. You have to be a specialist and you have to be trained in a microscope. Loops का जो है क्या कहते हैं, माइक्रोस्कोप एंड लूप्स में ये फर्क है कि लूप्स जो है आपको एक्सेस कैविटी तक अच्छा दिखा देगा. सो लेट्स से यू हैव अ ब्रोकन फाइल देयर, इट्स इजियर टू रिमूव, बट डीप डाउन जिस तरह कि मेरा केस था, यू डू नीड अ माइक्रोस्कोप, बट यू नीड टू बी ट्रेन्ड ऑन इट. लूप्स का लर्निंग कर्व इज 1 month, माइक्रोस्कोप इज 3 to 6 months. इट टेक्स टाइम. ठीक है, यू हैव टू कीप एट इट. सो नो, माइक्रोस्कोप इज नॉट एप्लीकेबल अनलेस यू आर ट्रेन्ड. जहाँ तक कॉस्ट इफेक्टिवनेस की बात है, लूप्स के लिए भी लोग यही कहते हैं. आई थिंक people usually complain they're too expensive. It's a matter of it's your thought process. I have been trained on a microscope. When I moved to Pakistan, people told me, "Yaar, yahan to main kaun microscope dega?" I'm working with a microscope. At Shifa, when I asked for it, they eventually gave it to me. And then जहाँ पे गाड़ियाँ 1.25 करोड़ की हैं इस मुल्क में, it's all about priorities. तो अगर आप गाड़ी पे पैसे खर्च सकते हो, आप iPhone 14 Pro Max पे कर सकते हो, तो आप माइक्रोस्कोप या लूप्स पे भी कर सकते हो. But it's a fair question. It is an expensive piece of technology. It's basically more applicable to hospital-based settings, but you need to be trained on it, and then eventually cheaper versions are coming in as well, which are not that expensive. Plus, it's an excellent marketing tool as well. So once you record something on the microscope, you can display it on your social media and then attracts patients to you as well. So उसके बहुत सारे फायदे हैं. It's I think for one, I'll be honest, I can't work without a microscope anymore. I just can't. And people think it's a disability. I think not. I am very receptive to technology. I think I'm going into lasers now, although it's very expensive as well. So I'm waiting for the price to come down. But if you go, let's say 20 years back, and rotary came into play. So people who were just doing hand filing, they were resistant to change to that technology as well. And then same, so whenever new technology comes in, there is resistance. फिर लोग यही कहते हैं कि यार तो बड़ा महंगा है, या फायदा नहीं है, या अभी तक तो हम ठीक ही कर रहे हैं. What's the point of upgrading? But eventually that technology takes over. And the earlier you get into it, the better it is.
Very sir. Thank you so much. And we have just one last question from a student of yours at Shifa. She's asking, she's actually looking for a master's degree in forensic odontology from Shifa, and she wants to know the scope and the degree if it's internationally recognized.
I'm sorry, I'm not the right person to ask. But I can connect her so she can approach me. I think I gave my Instagram handle as well. Or she can email me. She can take my contact details from you if she wants. But Dr. Muhammad Khan Asif, she is the forensic odontologist, and I think he is the right person to answer that question.
Okay, thank you so much, sir. And with that, we conclude this lecture of yours and our session. Thank you so much for this in-depth explanation, and thank you so much for taking out time for us. Your presence truly highlighted our event. Thank you for having us, sir.
The pleasure was all mine, and thank you for having me. Hope all of you have a good night and a good weekend as well. All right.
Thanks.
Thank you so much, sir. It was a wonderful lecture. Thank you.
My pleasure.
Okay, so dear participants, that's all for the first day of DENTCON 24. We hope you had an amazing experience. We know that we had a few discrepancies and certain delays, but they'll improve further in the following upcoming days. So we'll be back tomorrow with more innovating and exciting topics, so don't miss out. If you had any issues or queries, feel free to contact our organizers. And we hope most of your questions and queries were answered. We apologized if we missed some. We were short on time and there were too many, honestly. So we'll try to cover them up in the next.
Sorry to cut you out, Marij. Can we all please open their cameras so that we can take a group picture for day one? That would be really great. I request participants to please on their cameras so that we can take a group picture for the day. Okay, thank you so much, everyone, and thank you for your time. Over to you, Marish. You can give an ending note.
Okay, so like I said, thank you so much for joining us. We hope that we see you again tomorrow because we have many more exciting lectures. We have a lecture on how to improve CV and application. बहुत से इस तरह के questions आ रहे थे, but I told them कि आप next day रुकें, अभी answer होंगे Dr. G. M. Paracha से. And then after that, we have an amazing lecture planned by Dr. Ahmed Javed. He's Period Ninja on Instagram. And he's going to talk about how to secure DDS in Canada and also about periodontics in Canada. So hope to see you again tomorrow, and Allah Hafiz. Good evening.